Hey guys, it's Dr. Danielle Cooper, Dallas plastic surgeon. I wanted to talk to you today about the difference between breast augmentation with an implant versus fat grafting to the breast. So when someone says breast augmentation, generally we're talking about putting either a saline or a silicone implant underneath the breast to enlarge its size. Now, the nice thing about an implant is that it gives you that upper pole fullness or that rounded cleavage look that a lot of women are trying to achieve. The cons to using an implant is it is a foreign object and it is not a lifetime device. So if you were to have an infection with a breast implant, sometimes it warrants us having to remove the implant to allow you to heal from the infection and then having additional surgery to have it replaced if that's what you desire. And because it's not a lifetime device, at some point over your life, you will need to have additional surgery to have that implant exchanged for a fresh one if it were to rupture, for example. Now, alternatively, you can do fat grafting to the breast. And what's nice about that is it's fat that we take from another area of your body, usually with from your belly. We'll do liposuction to harvest the fat, and then we inject that into your breast tissue. Now, the nice thing about that is it is your own tissue, so once it's there, it's not foreign. You don't have to worry about having something replaced in 10 years or so. But it does not have the same shape as an implant. So because it's fatty tissue and it's compressible, it's different than an implant that is round and it holds its shape and is going to give you that upper pole fullness. A fat grafted breast is not going to have the same look as an implant breast, so just keep that in mind. The other thing is that with fat grafting, you may need more than one session to get you to the volume that you're trying to achieve. Just because whenever doing the fat grafting, we're trying to have the fat cells form a new blood supply and survive in the new location in the breast. So we have to see how much survives, see what your volume is, and then if you still want to go bigger, then we have to harvest more fat and transfer it to the breast with the goal of trying to achieve the volume that you're hoping to achieve. So that might be additional surgeries just in the fact that you might need more than one session to get to the volume that you're hoping to get to. Now, one of the cons to fat grafting to the breast is that, like I mentioned before, not all of that fat survives that we inject there. So it either gets reabsorbed by the body or it forms little oil cysts or little nodules called fat necrosis. Now, those things are not dangerous, but if you feel a lump or bump, you're going to want to go and get imaging done just to make sure that it is indeed these benign either cysts or nodules and not a concerning cancer. So that's something to keep in mind, particularly if you have a high family history of breast cancer. So I think there's pros and cons to either one. You need to just talk to your surgeon to decide which one would be best for you and if you're a good candidate for one of those procedures, if you're looking at augmenting your breast either naturally with your own fatty tissue or with an implant. So if you guys have any other questions, then feel free to leave them in the comments below. And any other topics that you're interested in learning about, please let me know.